Actually, when I come here, I notice that the teamwork is so important, especially as an interdisciplinary team, because most of general practitioners in this conference, they complained about how their work is hard, all different kinds of problems, and most of them was about the mental health issues. That's why I just felt myself so lucky, because we work as an interdisciplinary team, multidisciplinary team. We work all together, such as family physicians, nurse practitioners, registered nurse, social workers, outreach worker, mental health outreach workers, and dietitians. All together we work as a team, and if we have any problem and it is not in our scope of practice, the other team worker helps us. As a social worker, as they mentioned in this conference, lots of mental health issues we have nowadays, and I'm the clinical social worker, and I can offer therapy for my clients, for our patients, and therapy is really quick, really efficient way to deal with mental health issues. Also, I can offer not just psychological therapy, also social support, social therapy too. I think it's really good addition to the primary care.
I think they're currently already having a very strong role in strengthening primary healthcare. You can see this at events such as in Istanbul and last year in Gothenburg, where people are really engaged in having their workshops and telling their story about especially the improvements that can be made in primary healthcare. And connecting people is a very important role that this network has and succeeds, I think, quite good in achieving this goal.
Dr. Brisma, pourriez-vous raconter un peu quel est le rôle des centres de santé intégrés dans le développement d'un premier échelon de qualité?
Alors, c'est très important parce que les centres de santé intégrés permettent de traiter beaucoup plus de situations que seulement la médecine générale seule. Ça veut dire que nous pouvons suivre des patients beaucoup plus compliqués, avec beaucoup plus de comorbidité en première ligne.
Et pour ce qui concerne la communauté, est-ce qu'il y a aussi une approche qui s'oriente vers la communauté?
Alors ça aussi c'est un point très très important, puisque nous intégrons aussi des représentants de la communauté et des patients dans la gestion de notre centre. Donc ils ont l'occasion d'exprimer leurs besoins particuliers et ce qu'ils souhaitent dans l'organisation des soins.
Et le paiement, c'est un système forfaitaire. Pourriez-vous éclaircir quelques éléments qui pour vous sont des atouts dans le système forfaitaire pour avoir des soins de qualité?
Alors, d'abord les soins forfaitaires pour les patients et pour les travailleurs, c'est très pratique. Pour les patients, ça veut dire qu'ils ont un accès direct aux soins sans aucun frein économique, c'est un point important. Et pour notre organisation, ça nous permet de faire ce qu'on appelle de la substitution interne, c'est-à-dire de faire des transferts de tâches vers d'autres types de professionnels sans difficulté.
Y bueno, la atención primaria en México es un tópico importante en el sistema de salud ahora, porque hace pocos años hemos tenido una gran reforma en México que busca alcanzar la calidad de los servicios y la universalización de la cobertura, y la atención primaria está buscando mejorar la entrega de los servicios mediante atención integrada en diferentes partes del país.
At the WHO Regional Office for Europe, we have the new European Health Policy, Health 2020, which has the aim to improve the health of the people in the region and decrease inequalities. The third pillar is people-centered health system strengthening, and primary healthcare is really documented as the cornerstone of a people-centered system, also to foster transformation of care. This is very timely because this year we're going to celebrate and commemorate the 35th anniversary of the Alma Ata Declaration on Primary Healthcare, with also additional support from the member states to open a center in Kazakhstan, in Almaty, if approved by the regional committee. And this, of course, is very timely with the global move towards universal health coverage.
Primary care is under attack. And the role of the primary care health professionals are restricted. The aim being from authorities to reduce costs, giving us, or they mean to give us the role as gatekeepers, but they restrict our ability to accomplish this role. I will say that is the most pressing issue right now, and we are subject to a reform which sounds quite attractive for us. I'm not speaking remuneration now, but on a medical, academical and practical level. But we are restricted to accomplish it, so that is hard.
Okay.
For the European Forum for Primary Care, I think that it's a very good international association because it unites efforts of all countries of Europe and worldwide in developing and strengthening the primary health care and strengthening the capacity of all people involved in all levels, providing opportunities to share knowledge, to develop various initiatives and to work together towards common goals. This especially is good for Macedonia because we are also a country which puts lots of effort in strengthening and primary health care and developing the family medicine. Therefore, I think that the European Forum will contribute and we look forward to strengthen our liaison with our association.
My name's Nick Goodwin. I'm the CEO of the International Foundation for Integrated Care. The foundation is a not-for-profit organisation based in the Netherlands, and it has at the heart of its mission to promote the science, the knowledge and the application of integrated care around the world. It attempts to do that in a number of different ways, by having a scientific journal, by organising conferences and events, by being part of research and development programmes, but also moving into education and training programmes, as well as creating a knowledge centre to share information around integrated care across Europe and further afield. The European Forum of Primary Care and our foundation have a very common starting point, because when you look at the definitions of primary care in its widest sense and you look at the definitions of integrated care, they're really very similar. It's about continuity of care, it's around coordination of care, it's just about supporting the holistic needs of patients to get the care that they require at the right time in the right place. So the agendas are very similar. So the idea of the foundation and the idea of the forum is to bring people together to have these conversations about how we can think about working differently together, either in primary care or between primary care and hospital care, or between health and social care, or between physical and mental health care. And these conversations are needed because each organisation is faced with taking forward their agendas in a new environment, an environment where we have increasing numbers of older people, increasing numbers of people with complex chronic conditions, increasing numbers of people with comorbidities that need to be managed in different ways. So if primary care is to be taken forward differently, or hospital care is taken forward differently, we need to have that common understanding of the way forward. And I think the European Forum of Primary Care and the Foundation are a good match to do that through conferences and events, through exchange of knowledge, and we hope to be working together strongly over many years to come.
Well, actually, the important thing about the European Forum for Primary Care is it's not only GP's organization. So it's a multidisciplinary organization, and we are really in need of that when we are developing new systems, trying to find new ways. And in Turkey, you know, there's a very huge transformation, a big kind of a new system for the health care. And in that system, they recently actually introduced the family medicine scheme. So in that sense, we need to strengthen primary care in Turkey. And we cannot do it only with the GPs, I think. So we are in need of other disciplines. And also we are in need of making, actually creating new politics for the primary care and give some evidence to the politicians. So not only evidence-based medicine, but also we need some evidence in the organization level as well. So these are quite important for Turkey. And I really like European Forum for Primary Care because a lot of people join there, and I can meet people from different disciplines and make new contacts and new networks, which really help me in my work in Turkey.
Greece is struggling the last 35 years to follow the Almaty essential primary healthcare goals, but unfortunately is trying to do that not based on an organized primary care system. So you can understand that by definition we need to go towards this primary care direction, which is in the core of EFPC targets. This multidisciplinary approach, which is a primary care core element, is one of the main elements that Greek healthcare system organization miss, and I think that EFPC can help us very much to achieve this goal.
There is a big frustration among the patients. They feel unsafety. They feel that they cannot have the proper use of health services, and they feel insecure and they are afraid. This is the main problem. Of course, there are many other problems because we have a mental crisis too, melancholy, depression, anxiety disorders because of the crisis. Many of them are unemployed now, and they ask for free charge of the services. Although the charge is only €5, but there are people that even these €5 can't afford it, and so this is the main problem. What else? I think that this crisis affects all the kinds of our life.